A new study is revealing previously unknown risk factors for dementia. So these are more common health issues, things like vision loss and high cholesterol. But they've recently found to be linked to a decline in brain health. Primary care plays obviously a vital role in diagnosing and treating those conditions. And with a shortage of family doctors across Canada, there is obvious concern about whether we can leverage these findings to prevent cases of dementia in the future. Joining me now with more is Dr. Samir Sina. He is the Director of Geriatrics at Mount Sinai Hospital. Good morning.
Good morning, Lindsay.
So what do we know about why vision loss or high cholesterol can increase someone's risk level for dementia?
Well, there's lots of things that really impact our overall brain health. And so this is why we talk about keeping a healthy heart keeps a healthy brain. That's why we talk about maintaining your blood pressure, making sure you manage your cholesterol. These sorts of things not only keep a healthy heart, prevent heart attacks and strokes, but they also prevent blockages of arteries in the brain that can lead to dementia. But also vision loss and hearing loss, when you're not actually maintaining your senses well and you're not actually correcting challenges with those, then that actually decreases the sensory input to our brain. So we're not getting our brain the information it needs. And with that lack of information, it can actually lead to problems with thinking like dementia.
So it doesn't sound like you were surprised by these findings.
I actually was encouraged by these findings because this has been increasing work over time where we have, we've always said, is dementia an inevitable part of aging, or are there things that we can do to prevent it? So the nice thing about this recent study is it now says that up to 50% of dementias can be prevented or delayed. And I think the good news is whether or not you have a primary care provider, there's a lot of things that you can do as an individual to help keep your brain healthy and help potentially prevent or delay the onset of dementia.
Like what?
So, some of the things we were just talking about, making sure that one gets some regular exercise. And that's not running marathons or pumping iron. That could be just going for a walk every day for about 30 minutes, for example. It's looking at making sure that if you have high cholesterol, you're treating it. If you are actually prone to high blood pressure, you're making sure you keep that under control. And that you're also moderating your alcohol use. Things like too much alcohol can cause problems. If you're biking, as I do every day to work, wear a helmet, protect your brain from those injuries. So those are just some of the things. And right now, there's about 15 things in this report that we can do to help prevent dementia right throughout the life course.
Let's talk about the doctor shortage angle to this, though. Primary care is where diagnosis and treatment of conditions take place. I mean, more than 6 million Canadians currently don't have access to a family doctor. How equipped is our healthcare system to leverage the findings of this study?
This is the challenge. We not only have a shortage of primary care providers, for example, but we also have a shortage of specialists like geriatricians or neurologists, for example, that can also help confirm and better treat more challenging forms of dementia. So we need to make sure that people, if they have access to a primary care provider, are using those primary care providers, because people have them and they don't use them. But more importantly, we need to make sure that more people have access to this care so that things like managing cholesterol can be done with a professional. It's hard to do that on your own.
The Lancet Commission's latest report predicts that by 2050, the number of people living with dementia worldwide could more than double to 153 million people. So what needs to happen right now in the healthcare system to help out with that?
I think we have to do a better job raising awareness, just like we're doing today, about the fact that dementia is not inevitable, that there are actually things that we can do to prevent and delay it, and nobody wants to get a diagnosis of dementia. So I think we're motivated. I just think we need to do a better job of connecting people with the right information that they can take on their own and manage, but also, as we just talked about, bolstering our healthcare system so that we can be there to support people to stay healthy and well.
Well, Dr. Samir Sina, thanks for connecting with us today. We appreciate it.
Thanks for having me, Lindsay.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.